in a bit.
Okay.
So I had introduced, yes, I'd given your background to the audience, so we could jump right in. So you could give us a little bit of the historical context of how bad the crisis is, and we'll pull up your slides to talk through what could be the response in the short, medium, and long term to the crisis. Yeah.
Okay. Friends, my pleasure interacting with you. My apologies for this technology glitch. I thought in the past 10, 15 days, I have got some hang of it, but apparently I haven't yet. Or there may be some other glitch, I do not know. We all know pretty much about what's happening in the world and in our country about COVID. I don't think many people in the world had any greater experience than you and I have today, because we haven't had historical experience for the past 100+ years of anything of this kind. And obviously, the short-term effects, both healthcare-wise and scare-wise and society-wise, and most important of all, economy-wise, are extremely debilitating and unprecedented. So what I've done is, I have put together certain slides only to put things in context, nothing new or original. What I would propose is to have as much interaction as possible, but the slides are only to sort of help us focus on the thing. There are three broad things in the slides. The first is, I tried to look at the Indian state in crisis times, crisis like this. The second is, I tried to look at the current situation emerging out of this crisis, or the situation that has that is resultant of this crisis. The third is the opportunity. I truly believe, as Paul Romer said, that the crisis is a great opportunity and it's a terrible thing to waste it. I know to view a crisis in positive terms is somewhat silly, but this is not something of our making. It's thrust upon us. I don't think anybody anywhere in the world had any control over it. Wisdom demands that we use it as an opportunity and see how best we can make the most of things presently and post-crisis. So these are the three broad approaches. If you're okay with this, then I'll quickly take you through maybe at least part 1, and then have some interaction, then part 2 and part 3. Is it okay?
Sounds good, sir. Yeah. We could move to the next slide.
Yeah. Shall we go to the next slide then? Okay, this is a generic one. This is when an emergency is handled better. The countries, look at South Korea, Singapore, Taiwan, to some extent, to a large extent actually, Germany today. These 4 probably are examples of extremely well-managed crisis. Not that they can escape the consequences of the crisis, both healthcare issues and economic issues, but in a large measure you can see competence. So what are the ingredients that make these countries more successful than others? Even countries like UK and United States, they haven't done too well. They could have done better, though they have immense capacity to handle it, and after the initial glitches they'll overcome them and then handle the crisis better, but they haven't really handled them well in the first phase. So the first is state capacity. This talks about how much resources are deployed by the state. For instance, take the tax GDP ratio. Some states can spend more, some spend less. India, typically at union plus state levels together, we spend about 23 to 24% of the GDP. Most of the rich countries, they spend about 35, some 40%, etc. Though some very successful and competent and rich countries spend only 18% or so. Examples should be Hong Kong, Taiwan, Singapore. These 3 are exceptions. At a relatively low cost, they're able to manage both high capacity and high competence. But in general, state capacity is an issue. Capacity alone is not enough. Capacity meaning the number of persons at disposal of the state, the public servants, the money is spent, but the competence, the culture of competence, and the ability to actually deliver, the institutional capacity to actually deliver. The third is rational, evidence-based, consistent decisions. You can see in South Korea, you can see in Singapore, you can see in Taiwan, you can see in Germany. There are no confused messages. And there are rational decisions, not impulsive, not ham-handed, not amateurish, not a silly approach that, there's no problem with the disease, or there is a simple answer, chloroquine will solve it, or the last 24 or 40 hours we have seen, if disinfectants are injected, or if massive radiation dose or some other strange thing is given to the body, somehow virus will be controlled. These are all uninformed things which undermine the ability of the state as well as the credibility of the state. Then public trust. Public trust and credibility are a function of the above three. The state capacity, state competence, and rational decision making. Only then people trust. It's not authoritarianism that wins. It is a public trust. If in Singapore, by and large, people follow the government's guidelines, it's not so much because of authoritarianism. Somehow in India, we think Singapore is authoritarian. They put everybody in prison. No, they trust the government. Government has earned that trust. Then you have a broad national consensus. You know, complex and vast countries like ours, federal countries, multilingual countries, multi-ethnic democracies. Obviously, there is another issue, namely the consensus across the board, union and state level, and for politicians and bureaucracy across the board, there must be a broad consensus and national will. And finally, robust infrastructure and systems. In case of healthcare crisis, do we actually have robust healthcare infrastructure? We don't. We are lucky, we lucked out because of the warm weather, maybe because Indian people are somewhat more innately resistant to coronavirus-like infections, not merely this, but other infections. I don't want to go into technical reasons why it is so, but just to give one sentence clue, the receptors that is required for the virus to enter the respiratory cells, they seem to be either less in number or absent in some ethnic populations, notably South Asian. That may be one of the reasons, we don't know. It may be because BCG vaccine is helping us, that's one theory, not yet proven, but it's not surprising because there are other diseases that are helped by a generic improvement of the immunity of the population because of BCG. So whatever be the reason, I think we have lucked out. If India actually had the kind of infection rate you are seeing in rich countries, proportionate to the population, our healthcare system would have completely collapsed, let alone the other health problems, and we have plenty of them, the world's largest quantity of healthcare problems. But corona itself, the COVID disease itself, would have been unmanageable in our country. So we have lucked out also. But it's not because of our effort or the state's capacity. Our healthcare systems are anything but robust. We have one of the weakest systems in the world. Next, please. But there are some strengths. It's not that everything is bad about us. One is there's a focus of authority in times of crisis. Normal times, we're very confused. There is a system of alibis in operation. But in emergency times, at least the Prime Minister, the Chief Minister, the District Magistrate, the Municipal Commissioner, these four are more or less the key functionaries in India. Everything revolves around them, and they have enough of command and control and coordination ability. The second is the ability to coordinate and control at critical levels. No, it actually stems from the first one. The third is presence of strong institutions. Again, you have the ability to deliver, not only focus of authority, but institutionally, their word is a law locally in times of crisis. And actually, there's a system of delivery. Even if normally our system fails to deliver, in emergencies and specific situations, we do reasonably well. You take, for instance, the election management. You take a disaster relief, for instance, cyclones or floods or something, disaster management, more than even relief management. You take a VIP visit, some people would call it disaster management too. Whenever a Prime Minister comes, Chief Minister comes, everything becomes bad. Suddenly, bureaucracy becomes very alert and effective. And a crisis like COVID. So we have special institutional capability during those times because we have the practices and precedents in place. I don't want to go into details, but later if you want, we can go into one or two examples so that you can understand what it means. But you can rest assured we have those instruments in place. Next, please. But we have weaknesses. They're very well known. These weaknesses afflict not only emergency situations, but generically our governance system. Inefficient bureaucracy, corruption, absence of basic infrastructure and systems, incapacity to involve non-state actors is one of the key things. Except as mendicants, We don't treat people with respect, and even organizations we're willing to support. All that we say is, you fund Prime Minister's Relief Fund or some such thing. But we have very little capacity in involving the talent and resources of society in handling any kind of a governance crisis. Because we have a clientelist state where the state treats the people as mendicants, as supplicants. It's the state versus subjects, not citizens with equal rights and ability to actually influence the state's functioning and improve the outcomes. Then impulsive centralized decision making. The very that we have in PM, CM, DM sometimes could also be very dangerous, because if there's uninformed decision, I'll give you one example. For instance, take demonetization. If only we printed the currency notes in advance to make sure that when the old currency, which is no longer legal tender, is surrendered, they have alternative currency available, which is their legal right. Constitutional right actually is a fundamental right. Things would have been much better managed, but we just precipitously announced. If only we gave 3 days notice to many of the urban migrants from rural areas, most of whom are homeless, are living in appalling conditions, and without income they can't survive. And actually lockdown not only hurts them, but it also does not really give them any protection from infection because of the living conditions. If only allowed them to go back and give them some transport subsidy, and then taken care of their immediate needs of food and some money by way of welfare projects where they have Jan Dhan accounts and where they have ration card, things would have been much better managed. But no, we would have to do it impulsively and dramatically, causing the greatest inconvenience to the poorest people in our country. That's one example of inadequate preparation and precipitous decisions. Centralized decisions where whimsicality rather than rationalism is the credo. Next, please. You have limited decision-making tools. Even today, we have neither research nor evidence as to what to do. Again, I don't want to go into technical aspects, but mostly impressionistic or what we borrow from elsewhere in the world. We have no idea what's happening. For instance, what proportion of Indian population has already acquired some kind of a natural immunity because the low-grade infection spread? We have no clue whatsoever in this country. We haven't even done any kind of serious testing. Our testing is appallingly inadequate in terms of numbers for our population. Limited public trust. While in times of crisis, generally people fall in line. In general, we don't trust our government. There's a lot of resistance and a lot of hostility to the government, with good reason, with our past experience. Then large parts of state bureaucracy are untouched. There are certain elements of government which function reasonably efficiently in times of crisis. Rest of them, particularly in times like this when there's a lockdown, they have no work and we simply don't utilize them. We don't know how to utilize them. And incapacity to integrate and multitask. Our focus now is only on COVID. It's not even on healthcare in general. God forbid if somebody has a heart attack or a stroke, in most cases, we really don't know what to do. We hope that those things will not happen during this time because system is in a pell-mell. Similarly, other than healthcare, take economic crisis that is now enveloping much of the world and in India too. The whole world is looking at their respective economic crises and they're addressing that simultaneously. In India, we're saying, well, we'll see when the time comes. There's almost no serious effort. It's just some perfunctory things here and there. No capacity to do multitasking. Next, please. Obviously, there are some serious resource gaps in India. Take US. They have already, I think, allocated $2.1 trillion earlier. Just yesterday, another $360 billion. 2.1 plus 360, that is 2.46, $2.5 trillion. Another $1.5 to $2 trillion stimulus they're planning, some $4 trillion plus, 20% of GDP. Germany, $800 billion, which is 20% of their GDP. Japan, $1 trillion, which is 20% of their GDP. China, less so, some of it is concealed, but probably more than 3%, maybe up to 5% of the GDP. India, even what is announced is mostly rejigging the budget, nothing new. Even if there's something new, all this does not amount to even 1% of GDP, much less than 1% GDP. So there is a huge mismatch, our needs versus our resources. Next, please. So this brings us to certain issues. With this, I'll stop for the time being. We can have a discussion on this, the issues that emerge out of this. Then we'll have the second part. Our tax GDP ratio, as I mentioned already, is not too high. Therefore, you cannot expand the state's allocation of resources indefinitely. Public sector workers, they're very large in number relative to the organized sector. Though, if you take the public sector workers as a proportion of the total workforce in the country, we have one of the smallest in the world. This is a paradox. We only have about 2.4 to 2.5% of the total workers in the country working in government. Much of the developed world has about 8 to 15% people. Lowest would be 8 or 9%. Highest would be 15% of the total workforce in the country deployed in government. That means the government actually has the capacity in terms of the human resources. In India, we have only, as I said, 2.4%. If you add all the public sector undertakings, the commercial enterprises which do things which government need not do, your banks, your other public sector undertakings, your Navratnas, etc., etc., it probably comes to about 3.8% or so. But the problem is, they constitute about 65 to 70% of the total organized sector in the country, and they're actually dysfunctional. It's not so much the size of the government, it is the incapacity of the government. The delivery is appallingly poor, we all know. I don't think we need to explain this to an audience like this. Any of you interacting with almost any branch of government, any time in a personal capacity, you will find and you will face the humiliation, the delay, the inefficiency, the corruption, and a whole lot of other negatives that we all as citizens face in this country. Then public sector workers, I already mentioned. Then resource deployment priorities. Even the money available, our priorities are very skewed. Instead of focusing on the fundamentals, the infrastructure, rule of law, public order and justice, quality education and quality healthcare, and particularly public health systems, we are more concerned about freebies and very high cost, low impact, sentimental projects, or projects where a lot of commissions and kickbacks are possible. And of course, employees' salaries, public sector wages in India are very high relative to the private sector at the low and middle level. But their productivity is one of the lowest in the world. Then, of course, freebies and public sector wages I mentioned, high cost, low impact projects. So all these things are undermining our capacity to deliver in times of crisis. Frankly, they're also undermining our capacity to deliver in normal times also. Tarun, let's see if the next slide also is related to this. I'm not able to check. Next slide, please. Okay, we'll stop at that. Just go back. Go back to the earlier slide. Okay. Friends, I will stop at this. Then we'll go to the COVID current situation. And then we'll talk about the opportunities to really reshape the Indian governance process in the state and policy in the backdrop of this, because the power of the context, in my judgment and experience, is the most important influence in shaping the future of a nation, particularly when you are desperately in need of reform. If a status quo state is enough, if the state is competent already and doing well, all that matters is maintain status quo. Take Germany, take South Korea. You don't have to do anything spectacular. You simply have to maintain that level of capacity and overcome some of the kinks as they develop from time to time or absorb from time to time. Whereas in India, we don't have the luxury of perpetuating status quo and being content with that, because we have a very dysfunctional, incompetent state, and our challenge is how to improve its outcomes. And therefore, this is an opportunity. The power of the context is very important. There cannot be a greater context than a great war or an existential crisis like the current one, COVID, not only healthcare crisis, but economic crisis. A great opportunity, actually. A wise person always views the opportunity, the crisis as an opportunity. Therefore, the power of the context, using that, what are the areas where possibly change can be accomplished today much more speedily and much more efficiently, if only we have the good sense and leadership and in public discourse. That is the broad idea. So any questions, comments, any ideas so far in what we discussed?
So JP said there are a few questions on the chat, so I'll just kind of put them out there.
That'll be helpful.
Yeah.
So if you can read out, if you can actually read out or something, it'll be helpful.
Sure. So the first comment is around: are there states within India that have done well with their limited resources? And so, of course, Singapore, Germany, and Malaysia our external benchmarks. So one comment from Rohan Mahajan is, what would be kind of states that you would call out as having done well with the limited resources?
Okay, by all accounts, Kerala has done reasonably well. And southern states in general have done better than the northern states. Western states, up to a point, though there are some difficulties and special problems also, because take Mumbai. If you notice world over, the cities are more affected. The globalized cities are more affected, wherever there's more commerce and tourism and travel, etc. And of course, cities like Mumbai have a special problem because 60% of Mumbai lives in slums, and therefore there's much greater chance of easy spread of infection and all this social distancing and your lockdown are great luxuries in slum areas. But otherwise, you can see certain pockets where things are better handled, and they're not surprising. In most cases, they form part of a pattern because the governance is within Indian conditions slightly better, infrastructure is slightly better, resources are more, governments are a little more responsive. Now, at least in times of emergencies, there is state capacity to deliver. And therefore, Kerala undoubtedly stands out by whatever we know in handling this crisis. Kerala has had always this one advantage, not merely because of communist rule, and that's a mistaken notion. Right from the days of Narayan Guru, pre-independence days, Narayan Guru was the man who transformed Kerala society. He not only ended untouchability in Kerala, but also he laid the foundations for the modern Kerala state with its social policies and with the public discourse. And in many ways, post-independence Kerala is built on Narayan Guru's work. And also Kerala has had the privilege of one of the most enlightened princely states, their rule. The Travancore Maharajas, the Mysore Maharajas, and the Baroda. These are the three princely states which were the most enlightened in India. And Kerala was privileged both in terms of princely state governance and the social movements that transformed the scenario before independence and continue to transform Kerala society post-independence. Therefore, Kerala stands out, but southern states in general are doing better than northern states.
Thank you, JP sir. So on the same note, Mayudhar had a question. So his question is around local bodies, like how can we use the crisis to transfer more funds and manage public finances from the perspective of local bodies? So how can center ensure that more funds are being allocated at a local body level?
Great question. Shall we hold it up actually? That's part 3. What can we do now utilizing this as a crisis, as an opportunity? That's one of the things I listed. I have an idea, because there's no point merely frontally saying I want this to happen. Those of you who know Telugu, there's a Telugu proverb. You must be very smartly navigating your way. In a very complex situation, you must understand the principle of levers and see what change is possible. It's not that the changes required are not known, at least to some people in the government and outside. It's not that we did not recognize their necessity. We never did it. So just because we say it now, it will not happen. Therefore, you must use the power of the context to skillfully navigate your way and find those critical elements. Therefore, all local governments cannot be changed by using this crisis. But I think urban local governments, there is now space opening up. We have to fight hard. Maybe we'll discuss that a little later.
Sure, JP sir. So there are a lot of questions which are related to the impact of the crisis on various sectors. So directly on public health, what does it mean for welfare?
We'll come
economy?
to the second part then. That will all be covered in the second part. Okay.
Sure. And education as well.
Anything else?
So education, health, and welfare are 3 questions that are coming up. Yeah.
Okay. One thing is education. You cannot directly say it impacts education any worse than education was impacted earlier by misgovernance. Many of you are working in education field, I'm sure. We all know the crisis enveloping. I have made my case repeatedly. I'm sure many of you made your case repeatedly in public. There's a horrendous crisis. It only makes things worse today. But again, it could be an opportunity. I did not list it here, but let me therefore state, because anyway, it's not listed later. World over, today, just now, an hour ago, I spoke to somebody well known. His son is doing a Harvard postgraduate degree in management. Came back to India and now taking not only online course now, but taking the test online in the next few weeks or so. So now maybe an opportunity for us to utilize technology, because in some ways, while it's not penetrated adequately in India, in some ways, technology can be an enabler today. If the governments actually deliver genuinely, not merely spending public money on school education, but also deliver, it would be wonderful. But I don't see that happening anytime soon. Let's be practical. You all have seen enough of it. I've seen enough of it. But can we therefore leverage technology and see that the outcomes, not merely passing and stuff like that by rote learning and mass copying, but genuine tests of integrity where the competence of the person, the grasp of concepts, ability to apply the concepts, they are tested, but with integrity. And that's really a technology function, how to do it with integrity, etc. Can we take advantage of that? I think there's an opening there. I think many bright entrepreneurs and thinkers, they can apply their minds and see what best can be done. But there's also a downside to it. World over, whenever technology is applied to improve education, the social divisions and economic disparities get exacerbated. However much we dislike it, it is always the poor who have less access to technology. Therefore, they fall behind even further. Therefore, can we do something to bring down the cost of access to them and encourage the poor to get access to quality technology in order to improve educational outcomes? There is both an opportunity and a challenge available in education, but other sectors we'll discuss later, as I mentioned. Shall we move on to the second part?
Yeah. Let's move on, sir. Yep.
Okay. All right. Next slide, please. Next slide, please. Okay. Very bold, very simple statement to know. The current toll in India of COVID crisis, about 30,000 crores per day is my estimate of production loss, almost 40-50% of the GDP. I mean, obviously, it's not going to be very accurate. It's a ballpark number, but it's not wrong by an order of magnitude. It's not going to be 3,000 crores. I'm absolutely certain about it. It could be 20,000 crores. But a very significant loss of production in the country. Between 30 and 50% of GDP is lost for this time period. They could be globally and in India too. Maybe 5 to 10% of economic sectors may suffer long-term damage, particularly travel, tourism, transport, hospitality, that sector, and entertainment. Entertainment in the sense, not home entertainment, but cinema theaters, etc. I think they will suffer considerably for a very long period, even after the immediate crisis subsides. But in the interim, during this whole period of this fear, this paralysis, of the lockdown, of the self-induced coma, out of necessity, and sometimes out of the application of crude tools, shooting in the dark, there's a significant loss of productivity for the time being. Therefore, job losses, particularly in unorganized sector, are already very high. The varying estimates, but my estimate would be about 90% of all the workforce in India, 55 crores, they're all in the unorganized sector. About 50% of that 95%, they're more or less without work now. That's a humongous number. And the United States has added about, I think, 20 million people now. Latest number probably is 26 million people to the unemployed workers list in the last month or so. There is consternation, there is a sense of crisis. They're all hollering. India probably added roughly 10 times that number. 10 times that number during this 1 month, because they're unorganized sector people, because they're eking out a precarious livelihood even normally. We're not even taking that very seriously, nor is there enough of documentation. But the damage done in the short term, at least, is very, very considerable. If you take construction sector alone, there are about 5 crore construction workers, mostly immigrant laborers in our cities. Almost all of them are without work now. And construction sector, as we know, is one of the biggest employers. And also, it employs some 25 to 30 trades, not merely one kind of employment of bricklayers and masons, but a whole lot of people from a variety of fields. So the health of an economy is almost always measured in many countries. The health of the construction industry and real estate is an accident. Small and medium enterprises, as it is, our manufacturing is in a desperate state relative to large economies comparable to us. But such as they are, small and medium enterprises, so the government gives simply a farman. You will not remove them from jobs, and you will not stop payment of salaries without asking the question, where is the money? Take the United States. They have come up with something like $610 billion only to support the wages in the small and medium enterprises. 360 billion they have given, 351 billion I think they given earlier, 350 billion. 260 billion yesterday they approved. Only for small and medium enterprises, wage sector, wage bills, the government is funding them. And they're saying 90% is written off. They're using the banks to disburse the money to the enterprises. And if the money goes towards payment wages, then 90% is written off. If it's used for other purposes, they get very low interest long terms. Whereas in India, we know the situation. There's hardly any government support of that kind, nor is the government capable of supporting. Therefore, there is even a deeper crisis than almost any other large economy in the world. Agriculture supply chains are really in a disarray. Yesterday, in fact, my wife and I bought tomato at 10 rupees at home in the city. The farmers are getting 2 rupees per tomato per kg, which is a ridiculous price. They're losing dramatically. It's hurting two ways. One, there's no lifting of the produce at the farmer's level, neither harvesting nor transport. And such as that is transported, there is not much a demand unless it's actually perceived as a daily necessity, like, you require rice today or something else. And even vegetables and stuff like that, obviously, many people, they despair of getting it because there are no supply chains, and therefore even the demand is limited. So it's a very peculiar kind of crisis, not simply a demand crisis or supply crisis. It's a crisis at both ends. Agriculture already is over-regulated and already messed up by government policies. And today the crisis has become much deeper, if anything. Then propensity to act as big brother. You see, you watch any television channel, see the scrolls there. See the temerity of the lower bureaucracy, the petty tyranny. You come out, we'll put you in quarantine for 20 days just because you came out of home. We'll beat you up. We'll do this. We'll do that. No, the whole thing is as if, we're all committing murders here. The whole thing is about, citizens, I tell you what to do and you shut up and do it, rather than understanding the nature of the crisis. If you kill the supply chains in the name of a particular problem, and then if you only keep on talking about corona, you're not really solving the problem. The disease spread is contained up to a point, the middle class, upper middle classes, and even lower middle classes to a large extent adhere to this. But the poor simply cannot. Their living conditions are appallingly poor. And they live in enormous congestion, 25, 30 people in one shack in a slum. 100 people typically have one toilet. Where is the hygiene possible? Therefore, there are inherent limitations in a country like India out of this kind of lockdown. Without addressing that, and without realizing both our need for certain services and supply chains and the poor people's need to eke out a livelihood, we have one simple formula. Shut up, stay home. If you come out, if you have something, it doesn't work. And the big brother approach, now you almost feel, initially it was a sense of collective responsibility and, we care for our fellow citizens. Today, I'm in power and I'll give the order and you follow. Increasingly, the big brother approach. This is the danger during emergencies. State inevitably acquires power during emergencies. To give up power is going to be very easy. They get used to it, both the people and those in power, they get used to it. And the media accepts it meekly. They think it's normal. It's not normal. These are abnormal. They must be used sparingly, very rarely, for a limited period. Even that, with the people's consent and expecting and seeking people's willing cooperation, not compliance by brute force. It's a very bad tendency. It may appear nice. Any other country, it will not be tolerated. In fact, South Korean president said, I have no right to extinguish liberty of people. I will continue economic activity in a responsible way with all precautions and safeguards. And South Korea today is emerging as the best manager of this whole crisis. Though initially after China, they got the biggest scare on account of a religious sect, as we all remember. Even healthcare beyond COVID is in disarray. If God forbid any member of our family has a problem other than COVID, let's say some other sickness, some serious ailment which can't be postponed, we have to address it immediately. Things are in such pell-mell because of the poor hospital infrastructure and poor protocols developed and this mania, this obsession with only one disease. Just to put things in perspective, COVID killed by government statistics about 650 people or so far in the country. Every single day in India, 2,000 children below 5 years of age are dying. Every single day. Most of the deaths are preventable. Every single day in India, 800 tuberculosis patients are dying. Every single day. In the last 1 month alone, we probably had about 12 to 15 lakh malaria cases in India. Thousands died of that. I'm just giving some big numbers, but this applies across the board. We are pretending as if this is the only health problem. No, we have to put things in perspective. Next, please. Next slide. Okay. Take health scenario itself to understand the COVID thing in perspective so that we know what to do. Lockdown has yielded dividends, obviously. There's no question. Initial lockdown was necessary and welcome. Except that, no, they could have given notice to the poor people to go to the home places where they have some social security net available. A ration card, a Jan Dhan account, and the family support, etc. Giving them some transport subsidy. But barring that, I think it was right and it yielded dividends. Urban poor, homeless, and migrant workers, they are suffering in a very big way. Homeless persons, migrant workers, and slum dwellers cannot maintain social distancing, and disease therefore continues to spread. If you notice, after lockdown, there has been a dramatic increase in the spread of disease. Not because of lockdown, because lockdown is not a panacea. It has value for some time, up to a point. We must go beyond lockdown. SARS-CoV-2, that is the name of the virus as we all know, will be with us for about 2 years. This is not a 2-week or 2-month affair. It will be with us for 2 years. Next, please. The only way ultimately this will dissipate and then become a normal part of our life is if immunity spreads. Immunity spreads 2 ways. One is herd immunity because of low-grade infection to the bulk of the people without causing disease. That's how actually most of these viruses eventually become less and less important. Luckily, this is not a dangerously fatal disease like Ebola virus or Marburg virus or Eastern equine encephalitis or West Nile virus or even SARS. Even SARS had 10% mortality. Here it's only 0.3% mortality. If you actually go into numbers across the board, it's about 3 to 5 times more than the normal flu. So while it is very infective, luckily it's not really fatal. And for healthy people, it's almost not at all fatal. And therefore, we must look at herd immunity either by normal spread of low-grade infection. High-grade infection we must prevent at all costs, because if a large dose of infection are received, particularly by healthcare workers and others, even healthy people can be overcome before immunity can kick in. The second is a vaccine is available. A vaccine hopefully will be available in time, but it will take time. Even if we come up with a vaccine which is both safe and efficient or effective in the next few months, it will not take anything less than a few months to actually create manufacturing facility on a global scale and to bring down the cost and then to have the supply to make it accessible to most of the people. It's not going to happen anytime soon. Remember, polio vaccine was with us for several decades before we could actually make that vaccine available to the bulk of the poor people of India. Only about 10 years ago have we come to the level of eradication after 40 years of failure. So just because a vaccine is available in a country like ours, it doesn't mean that it automatically is accessible to everybody. So it's anything about 2 years, roughly 1.5 to 2 years, and with good luck and with a lot of effort in the country. Therefore, we must look at what is the best way possible at this point of time to deal with 2-year period, not 2-week period. As I mentioned, low-grade infection. Indefinite lockdown will not yield benefits for this reason. It will only destroy the economy. Severe COVID, mostly in elderly and those with the disease, a pre-existing disease like cardiovascular, heart disease or blood pressure, high blood pressure, hypertension, lung disease, or diabetes. These are the three biggest threats. So what it means is, if we protect certain segments of population, and if we allow the other people to go to work, but with certain safeguards, improve the testing across the board on a mega scale, both antigen testing and antibody testing, and take local decisions depending on the local context, because India is not one country for management purposes. It may be one country in terms of legal purposes. It's bigger than all of Europe put together. It's more diverse and more complex than all of Europe and large parts of Asia put together. So you can't simply treat it as one country, one shoe fits all, one decision, one direction. We have to allow local variation depending on the context. But in order for local decision making to be non-discriminatory and rational, you require data, you require expert guidance, and you have to build that capacity. Data, testing, and expert guidance. Next, please.
So JP sir, quick time check. So would you be okay to extend this by 5-10 minutes with kind of 5 minutes from 4?
No problem.
Yeah. Okay.
Okay. Second part is over. Now I have 3 more slides for the third part. Let's go back again. I will take some questions on this so far. Any questions, comments, ideas? I have some very controversial points, but because you have to compress everything, I had to make some vast sweeping generalizations. Some of them may not prove to be accurate scientifically over the coming months and years, but this is about the best summary, best synthesis of what we have currently.
So JP sir, one question from Nitesh is around how do we expand the meaning of universal health coverage, especially in light of your points that there is a crisis in the healthcare beyond COVID. So right
question.
Now, insurance models only cover tertiary care. Yeah.
Great question. Third part covers it. I'll come to that. Okay.
Sure. There are a few questions once again on how do we leverage the crisis for truly implementing 73rd and 74th amendments and empower local bodies.
Great.
Yeah. And one question
Anything
on
else?
Universal and quasi-universal income. Like, what are your thoughts on it and its relevance right now in the current crisis? Yeah.
Okay. Let me take this last one. Otherwise, we'll move to the third part because everybody is eagerly looking forward to that discussion. There are 2 parts to this universal basic income question. Part 1 is Indian state is at a very, very primitive level. The state is not able to perform its core functions of rule of law, that is public order, justice, and rule of law. Basic infrastructure and public amenities, infrastructure being transport and electricity. Mercifully, communications are no longer in the government's hands, and it's not required. But transport and electricity, in some form or other, government has to play a proactive role. And basic amenities, drinking water, sanitation, sewerage, waste management, and so on and so forth. Stormwater drainage, etc., which only government can do. And quality education, at least school education of quality, accessible to everybody without out-of-pocket burden. And quality healthcare of good quality, accessible to every single citizen without out-of-pocket burden. I have a big problem about a state not being able to deliver these basics and therefore not being able to promote equity and opportunity, pretending that it's doing something great for the poor by simply writing checks. This is a big challenge. The second problem is, where are the resources even if you want to do it? The third challenge is, unless you wind up all the existing dysfunctional or wrongly incentivizing subsidies and put them all into one simple basket, this is the money your family gets for the following reasons. And then we do it transparently. I think increasingly we have the capacity to do it transparently, despite India's weaknesses, because Jan Dhan accounts, digitization, Aadhaar linkage, things are improving there, mercifully. Therefore, if there is some political will, for instance, to take the disbursement of money to the farmers in Telangana state, this Raitu Bandhu, by and large, it's done reasonably well. No, the policy you can discuss, you can debate, but Once the policy is there, execution today, a direct transfer of money is no longer difficult. But unless you wind down those subsidies, you simply don't have the capacity. Let me give an example of the food subsidies. Much of them are dysfunctional. They create the wrong incentives. We are spending about 1.5 lakh crores only on food procurement, PDS, etc., etc. Now, unless you wind that up and then convert that into cash, directly going to people's pockets, you don't really have much money. And to wind it up, you require political will. It's dysfunctional. There's an enormous amount of corruption there. All kinds of wrong incentives operating. You only have to see how much a district supplies officer's posting costs in this country. I mean, you'll be astounded to see the kind of numbers now for officials, transfers, and postings, because there is so much space for corruption there. At every level, you have corruption. Food procurement, storage, the ration shops, the transport, all kinds of things, with all kinds of very crude laws in the country, utilizing the draconian powers of the state to their personal advantage at the cost of the consumer and the producer both. So, but unfortunately, the movement is in the direction of more and more PDS, more and more so-called food security in a country where food markets actually work. Therefore, the short answer, the synthesis of all this is, yes, we could consider it, but not without doing what the state must be doing anyway in the first place. That's the first priority. And two, not without winding up all the existing dysfunctional and inefficient and leakage prone and corruption prone subsidies. On that very cautionary basis, with those caveats, we should consider. And in times like this, certainly because we have the infrastructure now increasingly available, the transfer of funds is both feasible and it does come as a great support to the poor, at least momentarily. Shall we go to the third part, Tarun?
Yes, sir. Yeah.
I have 3 slides, and I think most of the questions so far I gather are really related to that. So I'll just place there. I will not talk much about them. They're self-explanatory. We can go into details of each of these. Next, please. Next slide. Okay, this way out immediate steps, 4 slides now. I think I stand corrected. Or maybe 3 slides, I don't recall now. Okay, South Korea approach for COVID crisis. I'm talking health part of it. Massive testing and contact tracing. Rapid tests are available now in the market of varying degrees of efficacy, and that supply is getting better and better, but we must be aggressive in cornering those supplies, both antigen testing and antibody testing. Then social distancing norms must be applied no matter what for the next several months until the disease is no longer a threat anywhere. Mass physical distance, hand sanitation, and so on and so forth. But normal economic activity with those precautions must be taken up. But protecting those above 65 or 70 years old and those with existing lung, heart, vascular, and diabetic disease. And efficient hospital care to meet the crisis situation if some patients do get the disease and they require critical care management. This is the only rational approach. Any other approach is doomed to failure. Already we're paying a very heavy price as a country because we have taken a one-shoe-fits-all model. And we have taken a panacea approach. Somehow COVID is a crisis killing crores of people, and we must stop people meeting each other and indulging in economic activity, and that is the solution. I think that's a very, very crude approach. It's a worthy approach in the early days when we did not know the magnitude of the crisis, did not have experience. In any case, we had to break at least one cycle of this infection. But that was shooting in the dark. Now it must be informed by our understanding of what is happening in the country and abroad and with the data. Therefore, it must be much more precise tools that we require and very targeted action, not these crude tools of shooting in the dark. Next slide, please. Then crisis as an opportunity. Agriculture supply chains. There are many things to be done in agriculture, but at least one thing I think this crisis should teach us. If we allow the global supply chains to come into agriculture, the Walmarts, the Carrefours, the Tesco's, or the Reliance, whoever it is, Indian or global, I don't care who it is, as long as they have managerial capacity, investment, and they have deep pockets, they must come in. What they'll do is they'll compress the market chain. Today, typically, there are 6 links in the market chain between the producer and the consumer. And these intermediaries are not exploitative rascals. These are all very poor people eking out a precarious life. The vegetable vendor in KBR Park, she typically sells about 20-25 kgs in a day. A day's hard work starting at 4:30 in the morning, coming by auto, investing some money, taking a lot of risk, paying off some public officials, some constables and others, enduring all the humiliation, taking the risk of rain, some other day, lockdowns like this. No, you never know when you have no market at all. So with all this, therefore they require about 15-20 rupees a kg. If everybody in the supply chain takes a significant proportion like this, because of inefficient market chain, the farmer is only getting 10 to 20, at maximum 25 to 30% of the end price. If I'm buying tomato today at 10 rupees, farmer is getting no more than 2 rupees. In some commodities, it will be higher, but average about 25 to 30%. Once you have supply chains, they go into grading, packaging, transport, storage, processing, and value addition, retailing, and most important of all, finding global market. Please remember, India has 12% of the world's agricultural land with plenty of sunshine, water, and good soil, and a long history of agriculture. We simply are not leveraging. Except in a few sectors like fisheries now, India is the world's biggest exporter. But we can be world champions in many, many areas with our strengths, if only we allow it to happen. So I think the supply chain disruption and the crisis caused now is a good opportunity to push for agricultural supply chains being globalized. The second is construction industry. We have to now, in the immediate context to revive the economy, construction industry must be given special concessions because that's where the biggest employment is. And we need also, because there's massive migration that's going to take place in the coming years. India is still the least urbanized of the large economies in the world. Therefore, inevitable migration to cities, big or small, is going to be there. Therefore, we have to give stimulus to that sector in particular. Manufacturing, I mentioned already. Unless manufacturing quickly is revived, I think even the few manufacturers in India, particularly in the small and medium sector, that die, it will be impossible to revive, and our presence in global supply chains will further diminish. Help to stimulate the demand in key sectors, example, real estate. Apart from encouraging the production, you also must actually boost the by taxation and by softer loans and more loans available for home purchases and so on and so forth, even bigger than earlier, because that is going to be the biggest stimulus to the economy in the short term. Then, of course, financial services anyway are necessary. So immediately put these things in the next few days in place, but with all the safeguards I mentioned. Certain areas we must assume for the time being they will not be revived. Travel, much of the tourism sector, hospitality, even entertainment like theaters, I suspect it will be much more long-term, world over, for a variety of reasons we understand. But these are the sectors which are both necessary, which are listed here. We can think of some other sectors. And they are our future hope if we really quickly move into gear. Next slide, please. Then 2 to 3 year horizon, building a robust healthcare system. There are two elements. This question quite a few people asked already. One is a robust primary care system. Today, why is our testing and contact tracing failing? At a centralized level, when you try to do it in bulk, you simply have no capacity to do serious testing on a rational basis and contact tracing. Only when you have a robust primary care system, take for instance, Delhi's Mohalla clinics. In the best case scenario, take the British GP system, general practitioner system, accessible to the community locally, with market forces operating because you can register with the GP of your choice, and the GP's income depends on the registration in that case. In case of Delhi, actually the visit is what gives the GP money. Both have their strengths and weaknesses. We don't want to go into details now. But building a robust healthcare information network, health information network, once you do that, proper local investigative network, already some people are experimenting. Andhra Pradesh has already a good quality healthcare network, diagnostic network with MEDA. There's a, sorry, 1 second, please give me time. My battery is running out. AP has already come up with a good diagnostic network. Okay. So we can easily do that. Diagnostics locally, the simple diagnostics, drugs locally, and of course, physical examination locally, and referral service. That is the most important element. The second most important element, the rest of the things I'm not touching. What is already existing, some Arogishri model, other things, etc. I don't want to touch now for the time being. The second is the inadequacies of the high-end hospital care in government sector are completely nakedly transparent in the face of the COVID crisis. As I said, because we lucked out, our hospitals' weaknesses did not kill thousands or tens of thousands of people in India. It's not because of our efficiency or delivery of services or our planning. We simply have lucked out. It's a terrible way of managing a crisis that could kill millions. We have to build hospital capacity in the public system. Just to give you a flavor, in the public health system, the tertiary care hospitals typically get about 8 lakh rupees per bed per year. That includes a medical college, a nursing college, and many other services. In private care, even in India, the high-end tertiary care hospitals, their billing annually is about 50 lakhs to 1 crore, but not less than 30 lakhs almost anywhere. Otherwise, it is not viable. This is ridiculous to expect quality care in Gandhi Hospital or Usmania or some other hospital. We're all shadow boxing. We're all pretending we're giving quality care. This simply will not work. We have to put in more money. Money means more resources, both human resources, wages, infrastructure, sanitation, all kinds of things. If these two things are done on a priority basis the next 2-3 years, FDR actually has created a blueprint for healthcare improvement. And those who are interested, you can access the website, FDR India website. We have interacted with the Government of India, with Niti Aayog, with a few state governments. Everybody is paying attention, listening to us respectfully, but there is no desire to follow through. I suspect now that the COVID crisis has exposed our inadequacies very cruelly, there'll be greater stomach, greater appetite for real serious reform in healthcare, rather than, as somebody mentioned, the insurance-based healthcare system. Tertiary care through insurance-based system world over leads to market failure. The cost goes up not because they're bad people. Healthcare is very costly, you must understand. High-end healthcare is extremely costly. The equipment, the new diagnostics, new models, patenting, this is a very complex area. And because they're rich countries, even if they expand lifespan by another month or two on an average, it's worthwhile spending hundreds of billions of dollars. We're not at that level. If you put in all money foolishly in tertiary care, without looking at the biggest bang for the buck that we spend, we'll be doing very foolishly. And even in rich countries like the United States, they find they're spending 18% of GDP on healthcare because they have entirely an insurance-driven model, a cafeteria menu approach. The cost is very high, the highest in the world, but US is rated as 25 to 35, even among rich countries. It's actually the lowest in healthcare outcomes among rich countries. It's a disgrace. You must follow the universal care model that Canada, in many ways, Germany, Britain, of course, NHS and others, in varying follow, but with participation and involvement of private sector, because in India, it's absolutely necessary. We have to bring in the competitive element without undermining the efficiencies of universal care model. And that's what actually we have built. Those who are interested can access that through FDR India website. Then I mentioned already retail chains in agriculture, so I don't want to belabor that point. Manufacturing hubs. Over-dependence on China is going to be a danger to the world. Everybody understands that, apart from the potential security threats of a big monolithic state in the modern context. And China is a big monolithic, all-powerful, sometimes draconian, near totalitarian state. But that apart, even if you discount that part, the fact that we're all depending on China from masks to ventilators, it is scaring the world. If supply chains fail for some reason in a crisis time, the whole world is at risk. Therefore, they are now open to supply chains elsewhere in the world. India can take this as an opportunity. So far, we have actually scrupulously prevented investment, despite our protestations, our labor laws, our land laws, our corruption, the hurdles we create, and poor infrastructure. They're all such disincentives, notwithstanding what we keep saying. Very little investment is coming into India relative to the opportunities that should be there and relative to our size. At least 10, 15 big hubs with land banks, with infrastructure of quality, with removing all the restrictive regulations, particularly labor laws and land laws, at least in those areas, and giving incentives and encouraging mass production and employment in order to become alternative supply chain to the extent feasible. We're not saying we'll replace China. Nobody can replace China. But there's a lot of space that's being vacated. We must utilize that opportunity. Next, please. Long-term, 5 years. This is where the local governments, etc., come in. One is city governance. I don't think we can now do anything significant in the short or medium term for local governments across the board, because the 73rd and 74th amendments are a disaster, because they created a very rigid and foolish constitutional framework. It cannot be easily altered. It requires massive consensus, which is not presently available in India. But there is space available now for looking at only big cities, let's say 1 million+ cities. 7 largest cities of India actually account for 50% of the consumer market in India for consumer goods. And if you take all the 1 million+ cities, they account for maybe 70% of the economy of the country. Because they're economic hubs, because they dictate the future of economic growth of India, because big cities are where the biggest crisis is faced on account of not only the COVID disease burden, but also the problems of the poor on account of urban poverty and homelessness and migrant labor. I think now we are primed to look at least big city in governance architecture. It will be easier to persuade the political class to create a new constitutional framework only for the big cities. Other things, let them continue for the time being. And we're not saying state government's role must go away. Something of a Delhi kind of a model, with the state having adequate control and safeguards, with adequate accountability. We have to create a new constitutional framework with empowerment, but with accountability. Civil services, at least now we must understand the importance of specialization, improving the capacity to deliver, and autonomy and accountability. What is called executive agency mode, at least in select areas. Wealth and job creation, this is more a public discourse issue than a governance issue. In general, in India, any wealth creator, any entrepreneur is treated as a suspicious person, a dangerous person, evil person. The state is supposed to be noble and pious, which is absolute nonsense. Without the wealth creators, there's no employment. Without wealth creators, there's no supply of goods and services. Without wealth creators, there's no tax. The state actually is guzzling our resources and acting as a parasite in most cases. We have to change the nature of our discourse. Those who invest and take enormous risks, those who employ people, those who provide goods and services are our greatest benefactors. It's a very noble endeavor. I think this message must go far and wide, particularly after this crisis. Once you shut down all the enterprises thinking that you're doing great good, actually you're doing immense harm. You're only accelerating poverty. It's possible that up to 30 crore Indians can go back into poverty now in the next month or two if the current situation continues, unless we address it very quickly. And that means about a decade's gains in fighting poverty are undone in just about 2 months' time. There is no substitute to a vibrant, a competent, competitive private sector, manufacturing sector, as well as services sector. I think that must be understood. The importance of entrepreneurship, creation of wealth, rather than reviling them, we have to actually start respecting them and even worshipping them. And then strengthening rule of law, at least no urban areas. Police are now using brute methods because people are docile in India and because the context is very complex and serious. By and large, they're keeping quiet, but this is a very dangerous way forward. We, at least to the extent of improving the police efficiency without resort to brutal methods in law and order. And at least for serious crime, insulating it from normal police and make it part of CBCID, and insulate CBCID from normal political vagaries. Those limited objectives, we can't go to the extent of Britain or America where the president or prime minister cannot intervene in a crime investigation at all. I wish we are there. We can't be there yet. It will take time. But we can take some small, important baby steps to make a difference. These are some of the things that occur to me that can be pushed using the power of the context today. If you have too many items, chances are nothing will happen. But if you have select items, focused areas, I think there are immense possibilities we can make the world much better for most of the citizens of this country. Last slide, please. Paul Romer is a Nobel laureate. He's one who said, I like this. A crisis is a terrible opportunity to waste. He said, it's a terrible thing to waste. Nobody wants a crisis, but it could be a great opportunity if you're smart. 1991 came out of crisis, not because of conviction, came out of compulsion. Oftentimes, big change happens by compulsion, but that requires wise people across the board understanding what are the possibilities and what is the best way out, what is most practical and doable, and pushing that. Let's hope that we can do it together. I'm sorry it has taken much longer than I hoped. Maybe I should have compressed, removed some of the elements. But I'll give time, Tarun. I don't know what your constraints are, but let's give a fair chance for participation and questions.
Absolutely, sir. We could take questions. There have been a lot of questions on the chat, so you could take questions for the next 5-10 minutes. Mayur, do you want to facilitate this?
Yeah, right. Thanks, Tarun. Sir, I mean, we have a question from Ritesh who talks about universal health and, broadening the definition of that because right now it's restricted to tertiary care only. So will that really happen and how will that happen? If you could shed some light there.
First is finances. India cannot afford 8%, 9% GDP. If wishes for horses, we could do anything, but the truth is our capacity to spend is limited. Much of the developed world is spending about 8 to 10% GDP on public health. From the government, I'm talking about. United States spends about 9 to 10% from the government, about 8 to 9% from the private sector, together about 18% of the GDP, the highest in the world, as I said. We don't require that. The government is today spending about 1.1% of the GDP, the lowest among almost all significant economies in the world, not only large economies, almost all significant economies in the world, the worst in the world. If we merely increase it by 1 more percent, another 2 lakh crores per year, but wisely, primarily focusing on the 2 areas, the primary health sector where through competition and choice, access to quality primary care without out-of-pocket expenditure is available. Already, Delhi has shown it's not a fully integrated model yet, but it's a very important and very successful model. NHS is the ideal model. We can have a combination and it will not happen overnight, therefore there will be intermediate steps. But that must be the architecture, broadly speaking. We will require about 250,000 or so doctors for that. And we have them, luckily. Unemployed or underemployed, India is the only country where there is massive ill health, massive number of doctors, massive unemployment among doctors and nurses. It requires genius to mismanage a situation this badly. So we require, again, equal number of nurses. Again, they're available because that's one thing we're good at. Once there is a pursued market demand, creating educational demand and then starting these courses, we're good at that. The quality of training may be inadequate. We can easily overcome that. There are ways of doing that. Quickly, we can give them a crash course of a month or so after their certification in nursing and medicine so that they're attuned to family practice needs. That's not a big deal. We can easily do it. And I don't want to go into details. But we can easily put in place in the next 2 years a decent, a robust primary healthcare system at a relatively low cost. And it will cost roughly, in my judgment, about 70 to 80,000 crores. Not one day, overnight, per year I'm talking about. And it will give a decent income to the doctors. Therefore, the incentive problem is removed. Doctors and the nurses and the other healthcare workers. And a significant number will be employed. They'll be private people. They'll not be government employees. Their payment is on the services rendered as a fee for services rather than as a monthly salary, which is unaccountable. And they depend entirely on the patronage of the people. And we can improve the systems by adding health information system, etc. And if only Indian governments are ready, or state governments and union government are ready, there are people abroad of Indian origin, medical background, who have deep insights into the way these systems function, who are willing to work with us pro bono, and then help us establish the system and design it and do all the many things that are required, put in place many things that are required in building a first-rate, robust, modern healthcare system. The second is an easier one conceptually. All the government teaching hospitals and the district hospitals, they can be converted to tertiary care facilities, not so much increase in the bed strength. Today, they are all overcrowded because there is no referral service. Simply, people go to the tertiary care hospital as a first point of contact. If they have a robust primary care system and screening for referral services, you would not require large bed capacity. It requires competence. Therefore, not increasing the bed strength, but improving the capacity, the personnel, the equipment, the hygiene, the wages, the incentives, the pharmaceuticals. The whole atmosphere must be changed. The moment you go to a hospital today in the public sector, almost anybody with any kind of expectations of some hygiene and quality delivery is deeply disappointed. The poorest of the poor go because there's no other recourse, and many of them actually suffer grievously. This is not the way we can build a healthcare system. And it's not the fault of the healthcare workers alone. In fact, in my judgment, for what they're paid and for what we're spending on healthcare, they're doing remarkable service. For a rupee spent on healthcare, I have done intensive study in Andhra Pradesh and Telangana. We are getting between 4 rupees and 10 rupees outcome, even at the low end of the market prices. Healthcare is one sector where the public sector actually is functioning well relative to the resources we give. If you don't fund at all, if you don't design systems, blaming them is a stupid thing. If we have to give resources, and then of course you have monitoring capability. Again, there are ways of doing it. Much of the world has done it. We can adapt to some of those practices with our conditions.
Right. Thank you, sir. So we have one more question from Vinita, and essentially, I mean, the question is about, post lockdown or post Corona. I mean, will the countries sort of work together, or will that lead to, let's say, more close border policies? Will the global economies, will the interaction be same, or will that change?
Some areas will not be the same for quite some time. Travel, tourism, hospitality, entertainment will suffer grievously for at least a year or more. Some people say we will never see pre-COVID world again in some respects. I do not know. But at least for a year or more, I think some of these sectors, there will be a significant decline. But many others, I think there will be a rebound very quickly. The demand will pick up very quickly. What is lost in this month or two, that is lost. But it will not have a lasting impact in my judgment, except the loss of production during this 2-month period, which will be significant, and therefore there will be a fall of GDP by about 10% if we assume a 6% average growth rate, but a fall of 10%. Let's assume about -4% worst case scenario. That's the range. But if it's a one-time loss, I think societies can take that. But the problem is even the limited sectors that are going to suffer on a long-term basis, the travel, tourism, leisure industry, the play industry, as I call it, as opposed to work industry, they employ 10% of the labor force in the world and in India too. So that's going to be a big hit in that sense. So we all have to figure out how to deal with that. But the rest of the sectors, if we do things smartly and quickly and efficiently and remove some of the unnecessary burdens imposed in countries like India, I think we will rebound very quickly. Demand will pick up, and the loss will be only one-time loss and short-term loss.
Thank you, sir. And then we have a question from Makaran on since independence. I mean, we've gone through multiple crises. So post-independence, I mean, have we managed to actually learn anything from the previous crisis and applied them in this current crisis? And what really helped in previous crises? Was it political leadership? Was it the civil society stepping in? If you could throw some light there.
See, post-independence, I would say there were two major crises that were actually leveraged to improve things. One was the food crisis of late 60s and early 70s. We were living ship to mouth. India was the largest importer of food grains, PL 480, Public Law 480 from the United States. Without the ships delivering the food in India, probably millions would have starved to death. That's when we continued and in fact further built upon the very rigorous draconian laws, Essential Commodities Act, rationing system, all kinds of things, which foolishly we are continuing even today. But one great thing that happened, where three forces came together. One is technology. The most important force is not government, technology. Norman Borlaug, probably the world's greatest benefactor ever in human history. Norman Borlaug and his colleagues, obviously there are many people who worked, but he was the progenitor of that whole band of incredible people, a Nobel laureate, an extraordinary human being. He is credited with having saved 2 billion lives. One human being's work and passion has transformed the food sector world over to an extent where probably the population of the world is now 2 billion more than what it would have been. No, some people can blame him because if only world population was not 8 billion or close to that, but only 5.5 or 6 billion, maybe things would have been better ecologically, but that's not the way we want to change things, right? We don't want to kill people. So Norman Borlaug and technology that the band of people across the world, including in India, that they have unleashed, was the most important driver. The second, unquestionably, when crisis was close to home, the political leadership did exhibit the will. Under Mrs. Indira Gandhi's leadership, I'm not an admirer of Indira Gandhi. Actually, I've been one of the harshest critics of Mrs. Gandhi all my life. But on this one issue, I think her leadership and her cabinet must be given unreserved credit. C. Subramanian was made the Minister for Food, one of the most exceptional ministers in the then government. Until the end of his life, I had the privilege of knowing him after leaving government and founding Lok Satta. He used to live in Chennai after demitting office as Tamil Nadu as a Maharashtra governor. An outstanding Indian, a tall citizen, one of the tallest of India, maybe the tallest at the time. He was a minister, and there was a civil servant called B.N. Sivaraman, and about 50 to 60 exceptional scientists across the world, across the country, from Andhra Pradesh at that time, the government in Andhra Pradesh. I can name 2 or 3 great scientists. One was Dr. Apparao, Alapat Apparao, who is no more with us. The another was Dr. M.V. Naidu, again, no more with us. Both passed away. And a few others. So exceptional scientists across the board. Swaminathan's name is well known, but I must add, there were many people of his caliber. Swaminathan was the most articulate person, that's all. But a group of all these people came together. But unquestionably, the government policy and the execution, very wise execution to overcome the crisis, it saw one of the weakest countries in terms of the food markets and food production become self-sufficient in food within 7 years. By the end of the 70s, India was self-sufficient. The exercise started probably in 72, 73. By 1978, 79, India was fully self-sufficient in food, which was quite remarkable. And just to put things in perspective, at the time of independence, India's total food grain production was 52 million tons. Today, India's storage during peak times in government godowns alone is 80 million tons, highest in the world. The second crisis, which I leveraged well, was of course the economic crisis of 1990. It was a crisis brewing over time, reckless and foolish policies of the governments over a period of time. Ultimately, 1991 became a nightmare under the very calm and very far-sighted stewardship of Mr. P. Narasimha as Prime Minister, and the technocratic capability and passion and wisdom of Dr. Manmohan Singh, the Finance Minister. They converted the crisis into opportunity instead of merely something to overcome the short-term crisis. They actually tried to engineer some things long-term. While the economic reform is by no means complete, but such as it was done was comprehensive. It was not half-hearted or incomplete in those sectors. The banking reform significantly, they changed it. The license Raj, significantly they put an end to it. But where they could not touch, we still did not touch. Agricultural reform did not happen. Many other things did not happen. But where they touched, they did comprehensively and well. We should be grateful to them. Without that work at that time, we would not be sitting here and discussing the possibility of India's revival and the future. by now India would have been a complete basket case. I think we should learn lessons from that. This could well be the third crisis where we utilize this opportunity. Other occasions, I do not recall any significant improvements we brought about on an enduring basis. We just dealt with the crisis for the time being, pretended everything is over, and business as usual from next year onward. Our record has not been very, very good in other respects.
Right. So, sir, one final question before we have closing remarks from you. The question is from Kuldeep. This is, on the Indian state. I mean, like you pointed out, crisis is one time where the state acquires more power. But will the crisis, going forward, lead to more decentralization of power? Because we've seen in states like Kerala, it has panned out really well. So will that really lead to a decentralization, or would you think that the state would acquire more power going forward?
The temptation will be to acquire more power, to centralize even more. I wish that it's a very positive news. That's why I am saying that if we all together raise the level of debate and build the demand for at least the urban areas, that's sexy. And many people are recognizing the problems. The industry is recognizing, some of the politicians recognizing, they all want economic growth. They realize that their political fortunes in some ways are linked with economic growth and prosperity. And therefore, if you use that argument and the current crisis and the special difficulties faced in big cities, maybe decentralization in big cities is possible. Otherwise, if that effort is not made, I suspect there will be more centralization, not decentralization.
So thank you so much, sir. There are a few questions, but I'll possibly direct them, maybe post the discussion on an email and take them forward. But we would like to thank you for taking time out and sharing your insights. As closing remarks, if I could ask you, what gives you hope in times of crisis? And also, what is the one message that you would like to leave young people with, and how they could possibly contribute meaningfully in this crisis?
First of all, this is not a crisis that any one of us look forward to. Something that is imposed on mankind. And let's hope that during not only my generation's lifetimes, but your generation's lifetime, there will not be a crisis of this kind, because we don't deserve it as humanity. But I suspect with increasing environmental damage, such crises may actually repeat themselves. Therefore, we must be prepared. This must prepare us for the future. Next crisis, we must handle better, more intelligently, more smartly, much faster. Luckily here, this crisis is not taking a very big human toll. Certainly, even one human life lost is one too many. But if we take the totality of the context, luckily this crisis is not taking too much of a human toll, not only in India, but even globally speaking, notwithstanding the dramatic headlines. But the economic toll is as big as it could be. It can't be worse than this. Even in a pandemic which takes away millions or tens of millions of lives, the economic devastation will not be much worse than this. In the sense, one element of the crisis, this is about the worst that can happen. I hope mankind will learn lessons from this and make things better for the next crisis if they do come. The second is, as we discussed today, crisis is an opportunity, particularly for countries like India. For countries that reach a level of civilization and prosperity and technology and system building and organizations, a crisis is not an opportunity, it's a nuisance, because they have to maintain status quo to maintain the quality of life. Whereas for us, in a desperate strait as a country, not a few people who are here and there, globalized, rich, technologically capable, highly productive, but the bulk of the people, a crisis is an opportunity, a great opportunity, because we can relook at things and look at the wastage and the inefficiencies and corruption and dysfunctionalities in our system, from the draconian laws in agriculture undermining the livelihoods and prosperity of 50% of Indians, to the stupidity of healthcare system, to the failed educational delivery in the country, one of the worst in the world in terms of educational outcomes, appallingly wasteful for a country which is intelligent and with a long history of and a culture of respect for learning. Now, this is the time to honestly look at them. In normal times, we may not be willing to listen to them. But now, what would be dramatic and unacceptable in normal times would be acceptable, because there's a new norm now. Therefore, the crisis is an opportunity if we selectively and intelligently use it. Finally, no matter what, notwithstanding this COVID crisis, life is still infinitely better than what it was 20, 30, 50, 100 years ago. I mean, I know moments like this suddenly make us feel, my God, what's happening, etc. But some of it is overblown. Throughout human history, mankind faced these crises. In fact, 90% of the indigenous human population in Americas, after Columbus landed there and after the settlers landed there, 90% of indigenous tribes, they died of disease because they had no resistance to infections carried by Europeans. Throughout human history, disease took a big toll. The Spanish flu in 1918 to 20, it killed 50 to 100 million people in a global population of only 1.6 billion, about 1/5 of our current population, but the death toll was 5 to 10 crore. So no, we are in some ways insulated from all that, and therefore the capacity to withstand a bit of pain is substantially. Therefore, magnifying the nature of the crisis. I'm not minimizing the danger or loss of life. I'm saying, hey folks, put things in perspective. Don't overly lament. We have a good life as mankind. We have immense opportunities. There is almost no crisis that cannot be overcome unless a big meteor hits planet Earth and then extinguishes mankind. That we can't do anything about. But normal things, including environmental crisis, we have enough technology and resources to address it in a calm and efficient manner if we start deploying them intelligently, not foolishly. And if we apply rational principles, science and technology, logic and evidence and best practices. And our own problems, countries like India, the poverty, the illiteracy, the ill health, the poor infrastructure, corruption, misgovernance, and 100 other things. There are 100 races and countries and civilizations which have overcome these problems, mastered these problems over time. And these problems are not unique to us. By adapting these best practices, by enhancing the quality of discourse, by demanding consistently and efficiently, effectively, for the specific changes, understanding the principle of levers, not for 1,000 changes, the few critical changes that will change the shape of many other things. If we keep at it collectively, not only do whatever we can individually and organizationally, but collectively have the larger picture in mind and push for that aggressively and consistently, but persuasively. Persuasive, not vindictive, not abuse, not rhetoric, but very compelling and persuasive, humbly. I think a lot more change is possible than is normally anticipated. Finally, let me quote one of Bill Gates' recent statements. I like that. He said, mankind often overestimates its capacity to bring about changes in 1 year, underestimates its capacity to bring about changes in a 10-year time frame. If even a small trajectory change is there, if you do it skillfully, within 10 years, there'll be a dramatic change. Economic reform, such as it was in 1991, was not really big. It was only partial, only in some sectors. But even the small trajectory change has shaped India of today. We cannot even shudder. We shudder to think of what would have happened if that did not take place. India would have been the basket case. So if we do the right things, the long-term trajectory, the changes will be very substantial. It may not happen in the next 3 months alone, but sometimes even within a few months, big changes are possible if there's wise leadership and with their skill in managing change. India is poised for that change, and we are lucked out in this case of this crisis, luckily because of the weather and many other factors. We could use this as an opportunity without messing up our economy, without tying ourselves in knots because of fear, because of irrational approach, because of one-size-fits-all model. If we do the right things, this could be an opportunity for us like 1991 and more. I wish you all the best. Have a nice weekend. Good luck. We'll be in touch.
Thank you so much, sir. And on this note, I mean, we would like to call it a close. Thank you so much, the audience as well, for taking time out. I would urge, if you're interested, you could possibly visit the FDR website. There are more insights and material available from the organization. So thank you so much for joining us. We'll see you soon. Thank you, JP, sir. Thank you once again.
Thank you. My pleasure being with you.